Hi, I am Shivani. We have Dr. Yamini with us, Consultant Clinical Head, Child and Adolescent Psychiatry. Now let us hear more from Dr. Yamini.
Namaste, I'm Dr. Yamini. I'm Consultant Psychiatrist. I'm the Child and Adolescent Psychiatry Clinical Head here at Maarga. I have completed my basic education from Bangalore and currently also have pursued fellowship in psychosexual medicine. My areas of interest include suicide prevention, trauma care, autism spectrum conditions, as well as child sexual abuse in child psychiatry, as well as geriatric or old age psychiatry. I tend to have keen interest in psychotherapies, neuropsychiatry, as well as psychosexual medicine. Currently, I'm also undergoing an online module training known as BEDIT, and this is to help in identifying child sexual offenders and also helping children to cope with this traumatizing experience.
Good to know about you, doctor. What is child and adolescent psychiatry about?
Child and adolescent psychiatry is a vast discipline and it has a vast number of conditions under it. There are problems which many children face in terms of behavioral, cognitive, intellectual, physical, as well as learning difficulties. So these can be categorized based on traditional diagnosis like attachment disorders, developmental disorders, autism spectrum conditions, of course mood disorders, anxiety disorders, schizophrenia, ADHD, and gender dysphoria.
Okay, doctor. So why do we need a separate discipline like child and adolescent psychiatry?
That's a good question. We need to understand that children are not miniature adults. So, like we previously noted, a lot of these diagnoses which are visibly present in children are also seen to occur in adults. But however, children are quite different from adults. Developmentally, with each stage of their development, children would have different skill sets and different abilities along with different difficulties. Hence, it's always necessary to deal with them differently.
So, please let us know what are the services that we provide at Maarga. And doctor, how do we evaluate a child with psychological issues?
Evaluating a child is a challenging process. Here at Maarga, we make sure that the child is as comfortable as possible. So hence, the initial clinical interview is of utmost importance. Beyond the initial clinical interview, we'll have to then go into assessments, and these assessments could be completely done by professionals, also well corroborated by attenders of the child. We must understand a complete comprehensive evaluation of the child also requires contributions from the parents who form the immediate family environment and also the environment in general, which constitutes cultural belief systems as well as stressors that have directly impacted the child's behavior. Beyond this, when it comes to interventions, of course, there are pharmacological interventions, which means with medications. In addition to this, we also look into how psychological management of these children can help. These include psychotherapies, particularly directed towards children, and hence this would constitute what we would do at our Maarga.
Thank you for your valuable information, doctor. I hope this helps everyone. Thank you.